بسم الله الرحمن الرحيم. اليوم راح نتكلم عن بعض النقاط الرئيسية في الإكزامينيشن لمادة الأورال diagnosis. أول نقطة راح نتكلم عن the main reasons to make the examination for the patient. Number 1, to get details of chief complaint. Number 2, to analyze the information. Number 3, to make a full image for the case, to understand what is the problem for the patient. Finally, to give the patient better care and good treatment. To have a skill, you should to be confident, attentive listening, use non-verbal communication like eye contact, and use closed or open questions. The chief complaint. The chief complaint is what we want the patient to tell us. What is the problem of them? The chief complaint is the patient's problem. Every patient should try to give us information about the problem. That is chief complaint. For example, I ask the patient, can you tell me why you came to the clinic?
I have pain here or here in this area.
We need to organize the information and ask him a question like close or open question. Ask him by what, where, when, or how, and open questions which the answer is yes or no. The most complaint is pain. Some questions I will ask the patient, is the pain sharp or dull?
Yeah, it's sharp.
Sharp? Okay. What makes the pain hurt?
When I drink cold water or just for cold, not for hot drink.
Cold or hot?
No, just for cold. Drink.
It stimulates with cold and...
Yeah.
Okay. What stops the pain?
It's about, I don't take, just sometimes I take a Panadol or sometimes some medication for that.
The medicine do you take for the pain is Panadol?
Yeah.
Okay. Does the pain prevent when you sleep?
No.
Okay. Stimulated by cold
drinks.
Okay. We now talk about history of present complaint. You must recall information about date of onset, duration and stimulate, which we talk now, and character of pain. Date of onset يعني بداية الألم والduration فترة الألم. بداية الألم متى كانت؟
It's maybe from 2 weeks ago.
Good. What's about duration?
Just for 2 or 3 days. Or just when I drink a cold drink, not for another thing.
Good. Do you take painkiller? We now talk about history of present complaint. We should ask the patient about this information and record it. First, we ask him about date of onset. Number 2, ask him about duration of onset or pain. Number 3, ask him about stimulus. And number 4, ask him about character of pain. Finally, ask him about painkiller. For example, I will ask the patient about this. What about date of pain?
It's, from 2 weeks ago maybe, or 2 weeks or 3 weeks ago.
Okay, and the duration?
It's twice or 3 days per day, but when I drink cold drink or cold water,
Stimulus.
Stimulus direct.
Good. What about painkiller? We take antibiotics?
No, not antibiotic. Just take Panadol or Difadol.
Good.
Yeah.
And we should know the site of the pain. What about the site of the pain?
I don't know exactly. It's here. Maybe here, like maybe it's here. Yeah.
We now talk about medical history. We must take a medical history for every patient. Medical history include present and past illness or disease, medications, chest surgeries, allergies, other problems. We should ask the patient if there is a childhood illness, and we should take about the symptoms in the body. We now ask the patient about systems in the body. Number one, respiratory system. We ask the patient about any breathlessness or chest pain or tuberculosis or cough or asthma or allergic for the respiratory system. Number two, cardiovascular system. We ask the patient about any heart disease or rheumatic fever or breathlessness. Number three, we ask the patient about gastrointestinal system. We should ask the patient if he has vomiting or diarrhea or nausea or dysphagia. Number four, we ask the patient about blood circulation. If he has blood disorders like leukemia or anemia. And number five, we ask about immune system disorders. Number six, we ask about neurological systems. And number seven, we ask about liver disease. And finally, number eight, we ask about urinary system. If he has the dysfunction of kidney or high blood pressure. Okay, now we ask the patient about the systems on the body. Okay, sir. What about the respiratory system? Do you have any problem with this?
No, I don't think so. No.
Okay. What about the cardiovascular system? Heart disease. Do you have anything in your heart?
Yeah, I have a heart attack from 1 year ago.
Okay. What about gastrointestinal system? Do you have vomiting or diarrhea or nausea?
No,
Something
no,
like
no,
this?
no.
Okay. What about your blood circulation?
No, it's good.
It's good.
Yeah.
Nice. Okay. What about the immune system disorders?
Yeah, I think it's good also. No problem with it.
Okay. What about your neurological system? Do you have any problem in sensation or weakness
No,
sometimes?
no.
Okay. Now I ask you about the liver disease. Do you have a liver disease or this dysfunction in your liver?
No, no.
Okay. It's good?
Yeah, it's good. Yeah,
Okay. What about your kidney?
it's good also.
Okay. What about the endocrine system? Do you have diabetes or do you have a problem in your thyroid?
No, I don't have it, but my father have diabetes, so I don't. So it's important to tell that for you.
Okay.
I don't have it.
Okay, now we ask the patient about social and family history. Social history, it aids in determining genetic transmission of disease. And I ask the patient about patient habits or occupation and personality, number of children or marital status. Okay, now I ask the patient about the social history. Are you a smoker?
No,
Okay. What about the alcohol drinks? Are you drink it?
I leave it from 5 years ago.
Okay. What about the drug abuse?
No,
Okay. Do you have any bad habits like
like
bruxism or
no, 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 no.
like
No one.
Okay. Are you single or married?
Single.
Okay. Now we ask the patient about family history. What about your family history? Do you have the father have diabetes or hypertension?
My father have diabetes. My mother no, not hypertension, no diabetes. Just my father have diabetes.
Is there congenital disease in your family?
No,
What about the allergy?
he take glucophage twice a day.
Now we ask the patient about dental history, and I ask the patient now, what about the last visit to the dental clinic?
I visit the dental clinic every 6 months.
Good. And are you brushing the teeth or not?
Yeah,
Okay. What about the oral hygiene?
it's good.
Now we talk about extraoral examination. Method of examination are inspection, palpation, percussion, auscultation. You should be systematic. That means you should to do same steps for all patients to do extraoral and intraoral examination. Number one, in the extraoral examination, general view. Number two, symmetrical. We should see symmetrical in the face to discover any tumors, swelling, abscess, scars, congenital disease, and infections. Number 3, skin. You should see the color of the skin and structure and morphology and see the change. For example, yellowish, that means liver disease, and redness, that means flushing or reactive response to allergic. Number 4, eyes. You should see the color of the eyes or wetness. For example, dry eyes, that means is Sjogren syndrome. Yellow or redness, that means certain types of disease. Number 5, you should examine the lymph nodes. The lymph nodes in submental area, submandibular, cervical, and supraclavicular. Abnormal lymph nodes may be larger or tender. Number 6, thyroid gland. You should examine the thyroid gland about location or palpation. The steps to do examination for thyroid gland. Number 1, place hand. Number 2, have the patient swallow. The thyroid gland moves up. Swelling in thyroid, that means goiter disease. Number 7, temporal mandibular joint. You should check the articular disc. If there is any clicking, grinding, rubbing, or sounds when open or close the mandible. You should measure intermaxillary space if there is difficulty in opening the mouth several times. Now we talk about intraoral examination. Number 1, you should examine the lips. You should examine the vermilion border. And you should examine the corner of the mouth, the joint between upper and lower border. And you should examine the labial mucosa in the upper jaw and in the lower jaw. You should examine the labial vestibule and you should examine the buccal mucosa and buccal vestibule. Number 2, you should examine the soft and hard palate. In the soft palate, you should examine the vibrating line. And in the hard palate, you should examine the minor salivary gland attached to gingiva. Number 3, you should examine the tongue for any swelling, abscess, and the tongue should be soft. In the examination of tongue, palpate to examine the ulcer or red or white area. Number 4, you should examine the salivary gland. Number 5, you should examine the gums, the gingiva, for any enlargement, and examination for interdental papilla for any swelling, redness, or ulceration or bleeding. Finally, you should examine the floor of the mouth. Finally, you should examine the floor of the mouth.